and today we'll be talking about how to lower cholesterol without medication. Nothing provokes more discussion with a primary care physician or a cardiologist more than topic of this being cholesterol being high and how to lower it. There is a lot of misconceptions and a lot of social media press against cholesterol lowering medications. And not everybody needs cholesterol medications. So I decided that I put together a discussion where we will talk about cholesterol and we will start bringing the knowledge which we have so that we kind of have a understanding how to lower cholesterol other than medication. So the topic of discussions will be today will be to how to lower your cholesterol without medications. For your participation and so that you are, I would say if you could scan this QR code on your phone, you will be able to log on to the presentation and you will be able to participate and you will be able to give us a live feedback. If you are on a computer, you could go to menti.com and then it will ask you this code, the one which is on your screen. If you put that code in, you will be able to see these slides and you will be able to interact. I will give you a second or so that you could scan it and or log on your web. But this will create a real dynamic. You will be able to send the questions, you will be able to vote, and you will be able to understand what we are trying to accomplish in this talk. Most common questions around cholesterol are: first is, what is cholesterol? And what is cholesterol is simply it is a fat which is critical to life, and every cell membrane is made up of cholesterol. So cholesterol is not a devil or a villain which we do. But too much of cholesterol start clogging up our arteries, and that's where the problem starts. Then comes in is what are the different kind of cholesterol. Cholesterol, one is a bad cholesterol which gets absorbed and clogs up the arteries, and there are good cholesterol, which is the HDL cholesterol, which cleans up the arteries. I have gone through these questions in big detail in our other videos, which we will link it in the description, and you should be able to see all these questions on your screens. Hopefully, you have the chance to scan this code or gone to menti.com and use this code, and you will be able to kind of interact with us. So, the $1 million question is how to lower cholesterol naturally. So let's start with polling. This thing is, if you have logged in and if you will put it in this simple question, do you have high cholesterol? You could put it yes or no. And with that will create a kind of a basis for the discussion which we will have going forward. So I will give a little bit of time to log into that part and then we will carry our discussion as we go along. Once the responses will start coming, I will start showing up on the screen. Next question is, if that is the kind of a core understanding which I have, any process which has to take care of some medical issues in the body. So today we are discussing about the cholesterol, and if the cholesterol has to go down, whatever we normally eat, our exercise, other habits, they all have to work on one of the chemical processes which are already established in our system. The pharmaceutical industry or the cholesterol medication, they work on one of these chemical processes, and our foods, our supplements have to align with those chemical processes, and they will work on those chemical processes to help us. So all natural products which have to lower or have to work on this thing, they must obey or they must act on one of those chemical processes. Next question comes in is, which of the following you guys think leads to high cholesterol? Whether you believe it's diet, if you exercise, trans fats, processed foods, stress management, sleep, and supplement. These all needs to be kind of discussed. On your phone, if you have logged in, you could send your response, whatever you believe in this one is. But let's talk about diet because we all believe diet is the major contributor to the cholesterol, but that is not true. The total amount of cholesterol which is circulating in your body, 80% of it is made by the liver and 20% is made or absorbed from your gut. How much liver is going to make and how much gut cholesterol is going to be absorbed, it depends on all the internal homeostatic mechanisms in the body. And what leads to how much cholesterol which we are going to absorb from the gut depends on not only the amount of cholesterol which we are eating, but what we are eating with it. There are two things which are very important, which hijack this body's internal wisdom or homeostatic mechanism. If you really eat right, where you are not eating a lot of processed food and the trans fats, your body has internal intelligence. It will not absorb those excess cholesterol which you consume from diet, and it will lower down the production from the liver. It makes it balance. But what happens is in our society there are two main changes in the diet are, number one is the processed foods. These processed foods are lowering the glycemic index. So what happens is all these simple carbohydrates gets absorbed from the gut, and these carbohydrate leads to spike in insulin, and insulin hijacks this internal intelligence or homeostatic mechanism and pushes everything towards cholesterol formation. Second is the trans fats. Trans fats is all the processed foods which we can buy from our grocery store, or all the stored in the packets, chips, all of them contain the very high quantity of trans fats. And these trans fats hijack your system and increase your bad cholesterol and lower your good cholesterol. There is always question comes regarding fats is whether you could eat butter is good, bad, or this thing. All saturated fats, it has nothing to do with butter. All saturated fats, they do two things. They increase your bad cholesterol and they also increase your good cholesterol. Now the question comes in is, if you eat simple carbohydrate with saturated fats like butter, then you are hijacking your system. But if you are talking about purely butter, then I think the net effect of increasing your good cholesterol and bad cholesterol, they cancel out each other. And many circumstances, it may be beneficial, but nobody can really tell you without doing blood test. But the most important thing here is simple carbohydrate processed meats. Sleep, very, very important, because when we don't sleep, the cortisol level goes up. There is a hormone from the stomach granule that makes you hungry, and we all overeat, and then the effect carries over into the next day. So sleep is very important as far as cholesterol management is concerned. Next is your stress management. Stress management is also equally important with the same mechanism, hormonal mechanism. Your steroid, your cortisol level goes up, your other catecholamines go up, and they lead to high cholesterol. Supplements and antioxidants, we are going to take it in a minute. So, in our body, Once we talk about the cholesterol, how we're going to lower your cholesterol naturally. These five mechanisms, they operate all our medications, which we as a physician prescribe. They all work on these five places. And we have natural foods. The topic of this discussion is these natural foods. They can also lower your cholesterol by acting exactly where your medications work. They can help you. So let's take a normal metabolism of this cholesterol. When the cholesterol is circulating in your body, your body, depending on your needs, what do you need cholesterol for? All cell membranes, hormones, vitamin D, and for bile salts. Bile salts are needed to digest fat in your intestine. So, if for all cell membranes, hormones, vitamin D, and the bile salts, so cholesterol gets used to make one of them, and the extra cholesterol get deposited into our arteries. So that's why it's important. If you look at the cholesterol profile of children, their cholesterol is or bad cholesterol is in 50s, whereas in United States, you could hardly find anybody above the age of 30 whose cholesterol is 100 or less. Very rarely. So most of the time, their cholesterol is very high because this cholesterol, when the baby is growing, this cholesterol is used to make cell membranes, hormones, vitamins, and all those things. So that's why baby's cholesterol is low. But once we get old, our cholesterol goes high because we are not exercising, we are not leading to wear and tear of the cells, and that cholesterol is not being used. Hormonally, we are saturated, so we don't need that. We don't get in the sun, so sun cannot convert your cholesterol into vitamin D. So these are the reasons why cholesterol goes up. Then how body get rid of the cholesterol is that this cholesterol ultimately gets converted into bile salts, and the bile salts are dumped into intestine to digest your fats, and then medications use this one as two places in the gut it can lower your cholesterol. Number one is these bile salts. Certain things and certain foods in this discussion, they bind to those bile salts and you purge the cholesterol out. You purge the bile salts and body has to make more or use more cholesterol to make bile salts. So that's one mechanism to lower your cholesterol. That is in the intestine. Second is certain things like fiber, they absorb, they bind with the cholesterol in your food and you pass it out. So the two mechanisms in your gut. Then is the liver. The liver, if we there is a very important enzyme we call HMG co-reductase inhibitor. Name is not important, but that is the enzyme which gets blocked by notoriously known medication, which is the statins. And these statins, they that's how they live in the liver. They bring this cholesterol down. Then also the your good cholesterol that brings extra cholesterol which is getting deposited everywhere or not used back to the liver to destroy it or convert it into bile salt and dump it to the liver. So there are two things in the liver which are mechanisms which are happening. Then third, well, the fifth one is there are a lot of indirect mechanisms where the lipoproteins gets go down and they work. So your medications either work in the gut on your bile acids or bile salts, or they help reduce the absorption of cholesterol. That's the mechanism two. Then the production of cholesterol in the liver, that's where your statins work. And then fourth is promoting the elimination of cholesterol by the liver. And the fifth one is the indirect mechanisms. This is where the pharmaceutical industry has been utilizing it to create drugs to work. So now let's explore how this thing works out. This is a kind of a schematic representation we just now went over by reducing bile salts. by reducing the absorption of the cholesterol in the gut, then the liver production, liver destruction, and then the fifth one is one which we are going to talk about. First thing is how we can reduce what do we have in our day to day eating which will reduce our cholesterol absorption. And these are the things if we start consuming. Most important thing is soluble fiber. Fiber is in all fruits, vegetables, oats, legumes, and whole nuts. These soluble fibers, what they do is they kind of create a mush in your gut and they bind to the cholesterol in the diet and you pass it out. This is the mechanism which we need to use. The way we had very common saying, apple a day will keep the doctor away. And that is basically is based on that apple will provide you soluble fiber, and that will prevent cholesterol being absorbed, and then you will not have heart attack, stroke, and you will have a good long life. That is the soluble fiber. Again, fruits, vegetables, legumes, whole grains. Second is the plant sterols. There are certain foods which you can consume, and they do is they chemically are similar to your cholesterol, and they compete and defeat your regular cholesterol so that it doesn't get absorbed. Those are your nuts. The Mediterranean diet, which we famously everybody is going after, this one is Mediterranean diet is very high in whole nuts and grains. That's where the plants steer. Structurally, they are similar to cholesterol, so they compete with the cholesterol, so the cholesterol cannot get absorbed. And third thing is flaxseed. Flaxseed, 1 tablespoon a day will lower your cholesterol. It will help you with keeping you healthy. And then most important thing is fiber or plant sterol or flaxseed. They all add fiber and bulk to your stools. So you will be regular. Not only your cholesterol will be down, you will be regular and you will feel better. So what's the learning point here? The fruits, vegetables, whole grains, legumes, small amount of nuts and seeds and flaxseed that will lower your cholesterol. How we could use it? Start the day with oatmeal. In the lunchtime, eat beans. Then add flaxseed fruits for snacking, and you will have lower cholesterol. And that is something. The most important thing is that these mechanisms. It's not that if you start comparing these mechanisms with the medication, you will always fail. These are the things which we do repeatedly, just day over day. If we are consuming these things, which are right thing to do anyway, if we do that part, you will not absorb cholesterol and you could lower your cholesterol significantly. Remember, the second mechanism is the bile salt. What are the foods which we have where we could push the bile salts, not let them get reabsorbed, so that we make our liver use more cholesterol and lower your cholesterol is through this mechanism. Again, the soluble fiber is the king here, which comes back to again, if you look at Hispanic diet or Indian diet and predominantly any cultural diet, it was predominantly fruits, vegetable, legume, and whole grains till we stopped cooking and we start going to the grocery store to buy all those ready-made stuff. The soluble fiber that again binds with the bile acids and you purge it out and you do this thing. This phycelium is very common. We all might have seen Metamucil. Metamucil is the most common brand on this one is that if you consume Metamucil, that binds not only the fiber that stops absorption of your cholesterol, but it also binds with the bile acids or bile salts and pass it on, and it helps you to lower your cholesterol. Again, the learning point here is fibers, and if you are constipated and if you are using your Metamucil or any kind of a brand which has a psyllium, you will be able to do that part. Next part is the how we could alter what are the natural statins. That is where I think we all should pay attention. There are definitely natural statins. There are medication or supplements which act exactly like statins. I have done a lot of research over the period of last 1 month on this topic. These medications can lower your cholesterol by just adding this one by 10 to 15%. Say for if you change your lifestyle, which we went over in the beginning, and then you added the medication which stops the absorption of your cholesterol and then bile salts. If you are doing that, those two interventions can lower your cholesterol by 10 to 20%. And this alone can lower, on top of that, another 10 to 15%. So we are almost at 35%. The cholesterol medications like statins, they can cut your cholesterol into half. So what we are trying to do is with the lifestyle and these dietary changes and also with these certain supplements which we'll talk about, they can bring your cholesterol up to low down by 35%. Not everybody needs cholesterol medication. The where conditions where the cholesterol medication or the statins are unequivocally proven to be very effective is the diabetics and the people who have already have event, whether heart attack, stroke, or stent or bypass, all or PAD. If you don't have these, you have this alternative option which you do that, and this is should not be used as a blanket kind of advice. Talk to your doctor and make this part as a these recommendation is a part of your daily routine. If you change all those things and you lower your cholesterol by 10-15%, your doctor has to use a lower dose of it because medication, and you will have less side effects. Next, these are the medications which are supplements and all those things. One of the most important thing which in my research was red yeast rice. I have to give plead my ignorance. I never ever gave importance. But this red yeast rice, 1200 milligram capsules they come in. They technically can lower your cholesterol as much as a lovastatin. Lovastatin was the first statin which was developed, and that is then we start making the synthetic statins after that, which are very effective in lowering your cholesterol. But red yeast rice can lower and put 10 to 15%, and it works exactly on the same hormone which I talked to you about, HMG co-reductase inhibitor. It works over there. Then niacin B3, we all know that it raises everything. It lowers your bad cholesterol, triglyceride, improves your good cholesterol. So it is a known factor and it's a part of most of the supplements which you see. Berberine was also a kind of a surprise for me. It definitely modulates the cholesterol and lower it, and it lowers your triglycerides too. This also was very effective, and there is a significant amount of data on this one. Is these, and then the rest is the fourth one is soy. Soy gets kind of a very different kind of understanding. It keep on changing. The studies keep on changing on this one. But I think the red yeast rice, niacin, out of this one, niacin has the most side effects, and berberine. If I have to, from this category, I have to add, it will be red yeast rice and berberine. These two are this definitely are on my list. Now, look at this. They work on the same enzyme as statin. So they will have all the side effects like statin. Some people do complain of muscle pain. Okay, very rarely some liver functions can go up, kidney functions go up. So don't start taking it and not get your check. Talk to your doctor and have yourself checked, and then everything is good to take care of the things. Next thing is these are the class where we do not know. We know that the cholesterol when it travels in your blood it gets talked to another protein called lipoprotein. We know these further on the list they impact this these lipoproteins and they decrease your bad cholesterol and improve your good cholesterol. Omega 3 fatty acids, we all know that is a fish oil, especially in the salmon. We all like it, eat it. If you have to eat a meat, I think the fish, salmon is probably the best recommendation for this one part. Niacin again comes back, which affects your lipoproteins. Then this is the your turmeric. Curcumin is this thing comes back again. Curcumin or the your turmeric will come in almost everything because it's very widely used kind of a spice, and it has a lot of functions. If you say ask like alone can is it enough to lower your cholesterol? No. If you combine turmeric with diet, exercise, of high fiber diet, fruits and vegetables, and probably red yeast, right? When you combine everything, the combination will work very well. Krill oil is again is the is the fish oil. Then these antioxidants and anti-inflammatory. Once the cholesterol gets absorbed into your intestine, your cells, the inner lining of the cell called the endothelial cell, they read them as a foreign. So the inflammatory cells come in. These inflammatory cells kind of engulf them and then they produce certain chemicals which recruit more cells which are bigger and more effective. Those are macrophages. These macrophages come and engulf all the bad cholesterol and they become big and fat. We call foam cells. Then they burst and they lead to more chemical response. And this leads to other cells coming in and they keep on adding up on it and keep on narrowing up on the plaque formation and start closing down your arteries. All the antioxidants and anti-inflammatory medications, they work on that process, indirectly stabilizing your cholesterol plaque and helping you to lose, to prevent. There are certain medications which, there are certain foods which actually bring bad cholesterol to your liver and make it destroy more, and that was the soy. The soy products were shown that they act like your good cholesterol or HDL cholesterol and they lead to more destruction of your cholesterol in the liver and leading to this part of it is. Other antioxidants which like these are the spices which you could add: garlic, whey protein, fenugreek, green tea, CoQ10. All of them have very good antioxidant and this thing. So if you put together, if start your day with, if you breakfast with high fiber, like whether it's oatmeal, then add green tea with it rather than you're drinking coffee, add green tea. And then when you're cooking, use turmeric, fenugreek, garlic, then exercise, sleep, manage your stress. When you add all these things together and red yeast, right, you could lower your cholesterol by almost 30 to 35%. So, like, if I have to put everything together and consolidate into one, like a takeaway home message, that will be start your day with your oatmeal that has a lot of soluble fiber, and that soluble fiber will stop you the cholesterol being absorbed from your gut, and then also bile salts, and then your cholesterol will go down. Add fruits and vegetables in every meal and snacks. Choose whole grain rather than picking up refined grain. Eat fish, which is high in omega 3 fatty acids. If you have to eat meat, go with the leanest cut you could get in food. Then use healthy fats. Rather than using butter or margarine, you go for olive oil. Snack on nuts because the nuts have fats that will and fiber that will keep you full for a long time. Then limit red meat, processed food, and I think should stop sugary drinks. When you fry over and over, even in a healthy oil, you make them a trans fat. So avoid uh, unhealthy fat. So if I have to put all the principles together, this is how we do this one is limit saturated fat and trans fats, increase fiber, increase, then add plant seed oils, which are like cholesterol and they prevent cholesterol absorption. Add omega 3 fatty acid with fish. Mediterranean style of dieting, which has high on olive oil and the nuts, basically those mechanisms which we have gone through that. The key here is to create a balanced diet which you could do. And then the supplements, whether it's a red yeast, right, niacin, or blood brain, talk to your doctor. Don't start taking the things just on based on one this part of it is. I think that was my whole presentation where I wanted to put all the principle on which your cholesterol medication, which are pharmaceutically produced, they work on different places. And I wanted to add the natural, normal stuff which you could have on this where they act. Goal here is to increase fiber, exercise, rest and sleep, and manage your stress. If you do that, your statin medication, prescription medications lower your cholesterol by 50%. These techniques, if lifestyle wise, these are simple, but they need to be done over and over and consistently. And these principles, you need to put it into uh, different topics. And if you do that, I am very hopeful your cholesterol will be down, you will live a long, healthy life. And once you change this not only will lower your cholesterol, it will make you regular, your sugar will come down, blood pressure will come down. These are the same lifestyle changes you do that, it just multiplies. So simplify the things, multiply them, and keep on doing over and over. I hope I have added some value. Our YouTube channel is Kundlas MD. Like, share, and subscribe. And please comment and let us know what are the other topics we should discuss in future. Thank you very much for giving us attention. I will see you next week in a new topic. Thank you.